I want to introduce this kind of mindset in your clinical practice. We call the pain trinity. The pain trinity includes 3 categories of pain generators, naming the inflammation, disruption, and adhesions. So we are treating our pain patients every day. They have pain from inflammation, they have pain from disruption, and they have pain from adhesions. So we are very familiar with inflammation. We use medications. We sometimes use biologics for inflammation. And today's talk is using biologics for tissue disruptions. That's regenerative pain interventions. Previously, we used surgery to repair some partial tears, but now we can use regenerative approaches for these disruptions. And we can use hydrorelease and operation for adhesions.